Welcome to the Trauma-Informed Care for Educators Learning Collaborative. My name is Miriam Silman, and with my colleagues at the Center on Trauma and Children, we're delighted that you'll be participating in this project. The Trauma-Informed Care for Educators Learning Collaborative is one part of Kentucky Aware, a project of the Kentucky Department for Education that seeks to increase awareness of mental health issues in students by educators and other school personnel. Trauma-Informed Care in Education is one part of that project, which is funded through a federal grant from the Substance Abuse and Mental Health Services Administration. Trauma-Informed Care in Education is not a curriculum. It's an approach and a structuring of the environment and interactions with students, families, and the community to support students who have experienced trauma at universal, targeted, and intensive levels of intervention. We know that 30% of students have had some kind of traumatic event in their lives. That means that at any given time, you and your colleagues are working with students who have had trauma exposure. Trauma affects all students differently, but it has a profound impact on the cognitive, emotional, social, and behavioral development and functioning of children and adolescents, which in turn impacts their school performance and behavior. Some students have adverse childhood experiences that don't rise to the level of trauma, but also negatively impact their school performance and behavior. The good news is that trauma-informed approaches are beneficial not only to students with known trauma exposure or adverse childhood experiences, but for all students. So participating in this learning collaborative and becoming more trauma-informed will benefit your entire school overall. Becoming a trauma-informed system takes awareness, implementation, and collaboration. That's why we've structured this project as a learning collaborative. Learning collaboratives spread, adopt, and adapt best practices across a variety of professional settings and systems to enhance the delivery of effective services. Research tells us that training improves knowledge in the moment, but that for implementation of new knowledge and skills, ongoing support and coaching is beneficial. Learning collaboratives do that by offering both face-to-face training and ongoing support and consultation. The Trauma-Informed Care for Educators Learning Collaborative will provide 3 face-to-face learning sessions this school year. In between those sessions, you'll have access to monthly webinars and consultation calls, as well as ongoing coaching and consultation from CTAC staff and the staff at the regional educational cooperatives. In addition, we have a Trauma-Informed Care for Educators Google group, which provides a platform for sharing resources and a forum for discussion. The learning sessions will focus on helping you to understand the types of trauma exposure your students may experience, the impact of trauma on children and adolescents, how trauma manifests in students in school and classroom environments, and skills and strategies for you to help students who are experiencing traumatic stress responses. In addition, we'll talk about the ways that working with students with trauma exposure impacts staff and school systems and give you strategies for prevention and intervention to address secondary traumatic stress. Moving systems from awareness to implementation is difficult. Research tells us that implementation is more successful when teamwork and collaboration are involved. That's why we've asked you to come to the Learning Collaborative as part of a team. The Learning Collaborative will be structured so that you have time for teamwork during set learning sessions and in between. In addition, we have a team here at CTAC. Dr. Ginny Sprang is the Executive Director of the Center on Trauma and Children and the lead for the Trauma-Informed Care for Educators portion of Kentucky Aware. She brings a wealth of experience, expertise, knowledge, and skill as an internationally renowned clinician, researcher, and trainer. My background as a social worker is in providing trauma-focused services, research, and training in Eastern and Central Kentucky. Dr. Laura McCullough serves as our education liaison. You may know Laura from KDE or the Behavior Institute, and she helps us to adapt trauma-informed approaches to fit with the professional educational framework you use. Josh Fisher-Keller is the training coordinator here at CTEC, and he is indispensable to all aspects of this learning collaborative. He also is our guru for all things technical, so he's your technology consultant if you have questions or concerns. Caroline Adams will also be helping with coordination and training throughout the Learning Collaborative. Dr. Monique Marrow brings expertise and a wealth of knowledge from her work with youth and juvenile justice system and as the developer of a nationally known and used trauma-informed care for youth training, Think Trauma. This is the second year of the Trauma-Informed Care for Educators Learning Collaborative. Last year, we trained 142 education professionals, from teachers to school psychologists, FRISC staff to counselors, school social workers, principals, directors of special ed, and many more. We had teams from elementary, middle, high, and alternative schools. And what we know is that trauma-informed approaches are very compatible with many of the education frameworks that you're already using, including PBIS, multi-tiered systems of support, and social and emotional learning. We're excited about the ongoing spread of trauma-informed care across Kentucky because it means that more students will be getting the support that they need to be successful at school. We look forward to seeing you at Learning Session 1. In the meantime, don't forget to do the pre-work reading that was attached to the email where you found the link to this video. If you have any questions or concerns, please feel free to contact me or Josh at the email or phone you see on the screen. We hope that your school year has started off well and look forward to seeing you at Learning Session 1.